Welcome, and thanks for listening to today's episode of Medical Device Global Market Access by Pure Global. Today, the host will discuss the operational hotspots of vigilance and trend reporting. For manufacturers, achieving faster, higher quality incident investigation, making correct MDR reportability decisions, and setting appropriate trend reporting thresholds are constant challenges. These aren't just box-ticking exercises. They're fundamental to patient safety and regulatory compliance, especially under demanding frameworks like the European Union's Medical Device Regulation, or MDR. Vigilance is the system used to monitor and report on incidents related to medical devices that are on the market. When an incident occurs, the clock starts ticking. Regulations impose strict deadlines, such as reporting serious incidents within 15 days, or as quickly as 2 days for serious threats to public health. This pressure demands a highly efficient process for investigation and root cause analysis. The goal is to quickly understand what happened, assess the risk, and determine if the event meets the criteria for a reportable incident. Making this determination accurately requires deep product knowledge, clinical understanding, and regulatory expertise. This leads directly to trend reporting. Beyond single serious incidents, manufacturers must proactively monitor for any statistically significant increase in the frequency or severity of non-serious incidents or expected undesirable side effects. This requires a robust data analysis system capable of identifying subtle patterns that could indicate an emerging issue. Setting the right thresholds for these trends is a complex balance. Set them too low, and you're buried in noise. Set them too high, and you could miss a critical safety signal. This process is a core component of your post-market surveillance, or PMS system, and must be clearly defined and justified. Why is this scrutiny so intense? Because vigilance is tightly coupled to the entire quality management system. The data from your incident investigations and trend reports are primary inputs for your corrective and preventive actions, or CAPAs. Without a credible and detailed investigation, you cannot implement an effective CAPA. Furthermore, these vigilance activities are what drive decisions about field safety corrective actions, or FSCAs, which include product recalls or the distribution of field safety notices. A flaw in your vigilance system could delay a necessary FSCA, putting patients at risk. When a notified body audits your facility, they will test these connections. They will demand end-to-end traceability, often starting with a single incident report and following its path through the investigation, the reportability decision, the link to any resulting CAPA, and its inclusion in your PMS and risk management files. A weak or broken link anywhere in that chain undermines the credibility of your entire PMS system. Therefore, a well-oiled, integrated, and meticulously documented vigilance system is not a regulatory burden, but a critical asset for maintaining market access and ensuring patient safety. If your organization needs help navigating the complexities of global vigilance, post-market surveillance, or any other aspect of global market access, please check out Pure Global. For more resources, including our free AI tools and database, please see the links in the description of this episode. Thanks for listening, and we'll see you next time.